Good morning, everybody. I'm Bernie Rosof, Chair of the Roundtable on Health Literacy of the National Academy of Science, Engineering, and Medicine. And I want to welcome everybody to today's workshop on communicating clearly about medicine, all in the audience and, of course, all on our webcast. This workshop is centered around the question, how do we provide clear written communication to patients with a focus on the patient experience and always the need to achieve the triple aim: better care, improving the health of the community and the population, and affordable care. As a matter of fact, in order to achieve the triple aim, we need a health literate population. The Roundtable on Health Literacy focuses on building partnerships, both public and private, to move forward the field of health literacy. As one of its major activities, the Roundtable sponsors workshops for members of the public to discuss issues of importance and issues of concern that impact the health, the safety, and the welfare of our nation. This workshop is not the first that the Roundtable has convened that cover the topic of health literacy in the context of medication use, adherence, and safety. And that attests to the importance and the significance of this topic. In 2007, the Roundtable held a workshop on standardizing medication labels, and in 2010, a workshop on the Safe Use Initiative and health literacy. You can find the summaries of these workshops on our Roundtable website, and probably a good idea to take a look at that because it'll help and bring again the significance of this conversation. There's a good reason that we keep coming back to this topic. Medications, of course, are a vital component of healthcare and healthcare delivery. But when they are used incorrectly, can result in poor outcomes, can result in definite injury, and often death. Research has shown that almost half of all patients misunderstand one or more of their dosage instructions. And slightly more than half misunderstand one or more warnings related to their medication. This misunderstanding does not necessarily reflect a failure on the part of patients or patients' families or caregivers, but also on the rest of us in the healthcare system who fail to provide information clearly and simply and take the time. Communicating clearly about medications with regard to risks, with regard to benefits, with regard to adherence, has the potential to greatly improve patient understanding, encouragement, and outcomes. This workshop attempts to contribute to efforts to communicate clearly by exploring the research that is currently ongoing and highlighting some efforts to promote better communication. It is worth noting that you will not hear today a lot about populations with limited English proficiency. This does not mean that the Roundtable Committee or the Planning Committee failed to recognize the needs of these populations. Indeed, that was not the case. However, the FDA regulations that govern these materials is focused on English language speakers, and most of the work done in this area is also centered around English speakers. So for the purposes of this workshop, we will primarily focus on materials written in English. However, we will also include a session this afternoon by Charles Lee, planning non-English speaking patients, to address this topic, at least at the beginning. Once again, I'll ask each Roundtable member to be noting throughout the day key ideas or concepts that are brought out in the presentations and the discussion. We do this each time, and it brings us back to the discussions we had throughout the day. At the end of the day, I will go around and ask each Roundtable member to briefly describe their key highlights, and we will have further discussion about those highlights the following day. The workshop was organized by a planning committee, and I'd like to reach out and thank each one of those planning committee members this morning. Irene Chan, Terry Davis, Jay Duhigg, Joan Median, Lori Myers, and Shano Yin. And also, I'd like to thank, as always, the staff who puts this all together and makes us all look so good. And Lila, raise your hand so everybody sees you. Melissa, and Alexis. We'll begin the day with a moderated panel on the patient experience, followed by a discussion period. I'll ask you to please hold your questions until the moderator opens the floor. And by the way, I've asked Melissa French. Melissa, once again, raise your hand. To keep track of time, so she'll be giving each speaker a 5-minute, a 2-minute, and a time up warning. I'll now briefly introduce somebody I know quite well, Dr. Terry Ann Parnell, our moderator for the first panel. Terry is a nurse and a nationally recognized health literacy expert and award-winning author. She's the principal and founder of Health Literacy Partners and specializes in providing solutions to promote health equity by enhancing person-centered care and effective communication and the patient experience. Prior to founding Health Literacy Partners, Terry was Vice President for Health Literacy and Patient Education for the Northwell Health System. In that capacity, she was responsible for the Health Literacy Strategic Plan and integrating concepts of health literacy, and integrating with that language access, services, and cultural awareness into core activities across the health system. Terry, that was a formidable introduction. Hope everything goes well.